Lung Cancer by Brennan Weiss and Ben Feldman. Lung cancer affects the lungs, which are the main organs in the respiratory system. There are two types of lung cancers. First, there's non-small cell lung cancer, which generally grows and spreads relatively slow. Next, there's small cell lung cancer, which is faster and is more likely to spread to other parts of the body. There are also two different kinds of risk factors, the first being controllable. These factors increase your chance of developing lung cancer. These include cigarette, cigar, and pipe smoking, and using chewing tobacco. The other set are non-controllable risk factors. These include being exposed to secondhand smoke, asbestos or radon, certain air pollutants, and coal dust, having a lung disease such as tuberculosis, and having a family or personal history of lung cancer. There are also many symptoms. These are a cough that doesn't go away and worsens over time, constant chest pain, coughing up of blood, shortness of breath, wheezing or hoarseness, repeated problems with pneumonia or bronchitis, swelling of the neck and face, loss of appetite or weight loss, and fatigue. When you go to the doctor's office to test for cancer, the doctor will begin by asking you about any symptoms that you may have and your medical history. First, a physical exam will be performed. Then, the doctor will also ask about the following: your smoking history, exposure to environmental and occupational substances, and your family history of cancer. Different tests that can be taken for lung cancer include a chest X-ray, which is a test that takes pictures of bodily structures such as bones by using radiation. Another test is sputum cytology, which is a test that examines a sample of mucus from the lungs. Also, spiral CT scanning, which is also called CAT scanning, is a special type of X-ray of the lungs. And finally, a biopsy can be taken, which is the removal of a sample of lung tissue to be tested for cancer cells. Once lung cancer is detected, tests are taken to find out if the cancer has spread throughout the body. Surgery is also a common form of treatment. Surgery for lung cancer involves removing the tumor and nearby tissue. Lymph nodes, which are small organs of the immune system, may also need to be removed. The type of surgery performed depends on the location of the tumor in the body. For example, a segmental or wedge resection is the removal of only a small part of the lung. A lobectomy is the removal of an entire lobe of the lung, and a pneumonectomy is the removal of an entire lung. In addition, radiation therapy is a common form of treatment. Radiation therapy uses radiation to decrease the size of tumors by killing cancer cells. Two types of radiation include external, which is directed at the tumor from a source in the body, and internal, which uses radioactive materials in the body. Chemotherapy, another treatment, is the use of drugs to kill cancer cells. Chemotherapy is given via pills, injections, or a catheter, which is a tube inserted into the body. This also helps prevent the cancer from spreading. Some treatments that are not yet perfected, but still being studied, include the photodynamic therapy, which is a type of laser therapy, and cryosurgery, which treats the patient by freezing and destroying cancer tissues. The average survival rate amongst lung cancer patients within the first 5 years of their diagnosis is less than 1%, and this is even with the treatment. This shows how unrelenting this disease is. However, the sooner the lung cancer is detected, the better chance they have of surviving. People with early non-small cell lung cancer have a 5-year survival rate of about 60 to 70%. Interesting facts. Lung cancer is the second most diagnosed cancer in both men and women, but it is still the leading cause of death among all cancers. About 50% of all lung cancers form in people who have already quit smoking. And 160,000 people die annually in the United States due to lung cancer. Surprisingly, this is more than breast, colon, and prostate cancer combined.